Good morning, and thank you for joining us in this National Patient Safety Suite webinar. My name is John Thornton, and I'm the Patient Safety Training Manager for the Health and Social Care Division here at Virtual College. This morning, I'll be talking you through some background on the National Patient Safety Suite, covering some of the courses that are covered in the suite, and also details of how you can access the training itself. So just before we get going, I just wanted to give you a little bit of background on Virtual College as an organisation. We've been trading for 18 years, and over that time we've accumulated over 1.3 million learners, making us one of the top 30 fastest growing companies in Yorkshire. We've also been voted one of the top 6 e-learning providers in Europe. We work with nearly 5,000 different customers each year, and we have over 500 key accounts which come from a wide variety of sectors, including 70 councils and all of the NHS trusts in England. But we also supply colleges and universities, as well as commercial businesses in the private sector. To meet the needs of such a wide range of customers, we need to have a wide and varied product range as well, which includes our learning management system, which we call Enable, our auditing tool, which is a fantastic way for various organisations to prepare for inspections. So, for example, a school might prepare for an Ofsted inspection, or in the case of healthcare, it would be a CQC inspection. We employ a talented team of in-house development specialists as well. So that allows us to offer bespoke course development solutions as well as mobile app development. Alongside the e-learning solutions, we also provide face-to-face training with our Lean Healthcare Academy, and this training is typically used by NHS trusts to improve efficiency without compromising on the quality of care. In terms of the online course delivery, we offer a range of training in a variety of subjects, including safeguarding, health and safety, management, HR, health and social care, inductions, and ICT. So, why do we need the National Patient Safety Suite, and why was it implemented in the first place? Well, in 2010, a national diabetes inpatient audit highlighted over 5,000 insulin safety incidents between 2003 and 2009. And as such, a national patient safety alert was issued by the Patient Safety Agency, stating that healthcare professionals required training in the safe use of insulin. In response to this, Virtual College and NHS Diabetes, as it was known then, developed the Diabetes Online Safety Suite, which has since trained over 225,000 people in areas of patient safety. With the restructuring of the NHS in 2013, central funding for the Safety Suite ceased earlier this year, and the Diabetes Safety Suite was then replaced by the subscription-based National Patient Safety Suite. So what is the National Patient Safety Suite? Well, since its early days when the suite consisted of only the safe use of insulin, the National Patient Safety Suite has now grown to become a comprehensive collection of patient safety courses that have all been developed by Virtual College in partnership with NHS England. The courses included in the National Patient Safety Suite are the Safe Use of Insulin, which was recently updated in July 2014, the Safe Management of Hypoglycaemia, the Safe Use of Intravenous Insulin Infusions in Adults, the Safe Use of Non-Insulin Therapies for Diabetes, the Safe Use of Insulin Syringes, Pen Devices, Pumps and Sharps, the National Curriculum for the Training of Healthcare Professionals who care for children and young people with diabetes mellitus level 1, the safe management of diabetes during end-of-life care, which not surprisingly has had a really big uptake from not only acute trusts but also CCGs and care home providers too. And finally, the newest addition to the suite, having only been released 3 weeks ago, is the omitted and delayed medicines in hospitals, which has been met with real enthusiasm from our existing customers. So, to give you an idea of the topics and the course content covered in each course without going into too much detail, I'll go through them one by one, but more detailed information on individual courses and what's actually inside and the content of each course can be found on our website, and the address will be shown at the end of this presentation. So the safe use of insulin covers topics like what is insulin, insulin use in the UK, insulin errors, devices, and also side effects and storage. The Safe Management of Hypoglycaemia course starts with a really good general overview or introduction, and then moves on to topics such as signs and symptoms, treatment, and prevention and education. Again, as with the Management of Hypoglycaemia course, the Intravenous Insulin Infusion course begins with a really good overview and introduction to the subject before moving on to talk about diabetic ketoacidosis and the use in adults during surgery and elective procedures. For nursing staff looking after adults with type 2 diabetes, the Non-Insulin Therapies course looks at the different alternatives to insulin, including oral therapies and incretin-based injectable therapies. Next up, we have the Safe Use of Insulin syringes, pen devices, pumps and sharps, which, as the name suggests, covers topics around syringes, pen devices, pumps and sharp safety. One of the most extensive courses on the Patient Safety Suite is the Safe Use of Insulin for children and young people with diabetes, which, as you can see from the number of bullet points on the screen, this covers numerous topics and as such will typically take longer to complete than the other courses in the suite. As I've already said, more information about all courses can be found on the website, so I won't go through them all, but to give you an idea, the topics for this course include phases of type 1 diabetes, insulin therapy, complications of acute and chronic diabetes, education of children and carers, and also nutrition as well as covered. You'll notice the logo in the bottom right corner of the slide, and that shows that this particular course is also supported by the National Children and Young People's Diabetes Network. One of the courses on the suite that's been really gratefully received, especially from care home providers, is the Safe Management of Diabetes during end-of-life care. Having said that, it's just as relevant to any type of care provider. The course itself covers clinical care in diabetes and end-of-life care, insulin-based and non-insulin-based treatments, and also intercurrent illness and treatment withdrawal. So last but by no means least, we have the newest addition to the National Patient Safety Suite, which is omitted and delayed medicines in hospitals. This is perhaps one of the most eagerly awaited courses on the suite, and the feedback that we've received so far has been really impressive. The areas covered in the course include traditional errors, errors of omission or delay, reducing risk, national patient safety incident reports, omitted antimicrobial doses, critical medicines, minimising harm, national guidance on minimising harm, local medicine procedures, monitoring medicines administration, and then there's a section on the medication safety thermometer, which, if your trust or organisation is involved in that, this particular topic is likely to be of real interest to, well, especially pharmacists or medication safety leads. So in addition to the 8 existing courses in the suite, a further 5 are currently in development and will be added to the suite throughout 2014 and also the early part of 2015. And that will bring the total number of courses in the National Patient Safety Suite to 13. Part of Virtual College's commitment to the National Patient Safety Suite is to reinvest subscription money back into the suite in order to develop new courses. Obviously, which courses are going to be developed and what's involved or the content of each course is completely dependent on the feedback that we receive from subscriber organisations. So the 5 courses currently in development that are due for release are the Safe Management of People with Diabetes, Dementia, Depression and Severe Mental Illness, and that's due for release in September this year. The Safe Management of Diabetes during pregnancy, and that is likely or will be released in October this year. The Safe Management of the Diabetic Foot, which is due for release in December, and minimising the risk of harm from medicines overdose, and that's due to go live in February 2015. We'll also be releasing a course that's intended for service users themselves, and that's called Get Moving, Get Healthy. And this is a course designed to promote a healthier lifestyle, and that's going to go live in November this year. So, to anyone who's new to e-learning, or for anyone who's less familiar with e-learning, I'm just going to go through some of the benefits and some of the pros for online training and delivery. Firstly, e-learning itself is very cost effective, especially when you compare it to traditional forms of training, such as face-to-face training methods. Another advantage is the learners are able to go at a pace that's suitable for them, and this is really important because not everyone or not all learners learn at the same rate. E-learning is much more flexible as well than other types of training. So if the phone rings or someone comes to the door or there's some kind of emergency, which is often something that happens in hospitals certainly, the training itself can simply be stopped, and when the learner's in a position to continue, they can simply start from wherever it is that they left off. And that applies even if they're completely logged out of the system. E-learning is also a great way to deliver training at speed, making it really efficient. And another advantage of e-learning is the consistency of the message that's actually being delivered as well. The message is always the same. It's also really convenient and very sustainable. So in order to actually access the National Patient Safety Suite and all of the courses contained within it, we use a really simple self-registration system, and you can see some slides of that system below. The web page contains full instructions on how to register, but all you have to do is enter your basic details like your name, an organisation, and your login details will be emailed to you almost instantly. So it's a really convenient way to access your learning. Once registered, you'll be able to log in and access your personal training record, which you can see in the screenshot below. All of your learning is accessible from here, and it clearly shows your learning progress as well as keeping you informed on course updates. So when new courses are released or added, they'll appear here and you'll be able to access them quickly and easily. Any e-learning course is only ever as good as the system that it's being delivered through. So you'll be happy to know that the navigation system to move through the Patient Safety Suite courses is really well laid out, very simple and very intuitive. From the screenshot below, you can see some of the basic features of that system, including the forward and back buttons there, which enables you to move to the next page if the screen has been completed. There's audio controls there, which enables you to control the volume of the narration, or alternatively you can turn it off altogether. The notes button there, which lets you make notes during the course, which you can then refer to prior to taking the assessment if you feel you need to do that. And there's also a glossary as well, which certainly in training, which is designed for medical staff, it comes in really handy, especially if the terminology is unfamiliar. Another point to note is that all of the courses are SCORM compliant, and basically what that means is that in order to progress through the learning, the learner has to actively click on the interactive sections of the slides, and that's there to ensure a good quality of learning is achieved. This will prevent you from going straight to the assessment without actually completing any of the learning. A really important aspect of producing quality e-learning packages is gathering and listening to feedback from learners. Below you can see what over 15,500 people had to say about our courses, and as you can see 90% of the learners that accessed our training said that accessing and navigating through the system and the courses was either very easy or easy, with only 10% of people describing it as difficult or very difficult. And also 93% of people would recommend it to a friend. Incidentally, the information contained within these reports can be accessed and produced by every subscribing organisation. Here you can see a visual representation of what learners had to say when asked if there was anything they particularly liked about the system or the module itself. And as you can see, the responses showed that they thought it was easy to use, easy to understand, and most importantly, easy to navigate as well. So, subscription options. It may well be that your organisation is already a subscriber, but if not, there are different options available if they are either thinking about or would like to subscribe to the National Patient Safety Suite. So for larger organisations, there is the option to subscribe for 12 months and receive unlimited access to all 8 existing courses and have automatic access to the 5 soon-to-be added courses as and when they go live. This subscription's £5,000 per annum plus VAT, and if 5 or more larger organisations wish to join together, they'll receive a 10% discount, meaning each one will only pay £4,500 plus VAT. For smaller organisations, they have the option to join together to purchase one site licence, and that's the case provided that the total number of staff in both or in total is 5,000 or less. So each organisation only pays, in effect, £2,500 plus VAT. Licenses can also be purchased on a one-off basis by individuals wishing to do one of the courses, and the table below shows the pricing structure, but it's important to remember that one license only enables one person to do one course. All of the individual course prices are the same as one another, although this is with the exception of the paediatrics course, which is £99 per license rather than £30. So just while we're talking about subscriptions, here's a selection of organisations that actually already subscribe to the National Patient Safety Suite. And as you can see, there's a wide selection ranging from private healthcare organisations to universities and NHS trusts. We also supply clinical commissioning groups across England, such as the Lewisham Clinical Commissioning Group as well. So if you're wanting to complete the learning in the National Patient Safety Suite, the first thing you'll need to do is to check to see if your organisation subscribes. And to do this, simply go to the National Patient Safety Suite.virtual-college.co.uk, and all you'll need to do is find your organisation in the drop-down list. And if it's there, your organisation is obviously already a subscriber. And if it's not there, then they don't currently subscribe. And if if you found that your organisation isn't a subscriber to the National Patient Safety Suite, then inform your chief nurse or pharmacist or learning and development team that they're not currently subscribing, and then direct them to healthcareer.co.uk/patient safety training suite, or alternatively ask them to email John Thornton on john.thornton@virtual-college.co.uk, or you can call John on 01943 885 086. If you're an individual wishing to complete the training, you can find more information at www.healthcareer.co.uk/patient safety training suite. Okay, so thank you. That's the end of today's webinar. If you have any questions, please email me at john.thornton@virtual-college.co.uk, and I'll respond to you directly. But thanks again for joining us today. Goodbye.